From Microbe TV, this is Beyond the Noise, episode number 30, recorded on February 13th, 2024. I'm Vincent Racaniello, and joining me today is your host, Dr. Paul Offit.
Hi, Vincent.
This is the video version of Paul's column on Substack called Beyond the Noise, cutting to the chase on important health topics. And today we're going to talk about Paul's latest column, which is called Why I Wrote a Book About COVID. And I happen to have a copy of it right here. It just came out. Today's the publication date, I believe, right, Paul?
That's true, yes.
It's called Tell Me When It's Over, An Insider's Guide to Deciphering COVID Myths and Navigating Our Post-Pandemic World. And so the name of Paul's column is Why I Wrote a Book About COVID. So maybe we should answer that question right at the top. Why did you?
Largely as a catharsis. I think I was fortunate, I guess, to be on the front lines of this in some ways. I mean, the virus came into this country in roughly January of 2020. The first death was recorded in February of 2020. Francis Collins put together a group of advisors, if you will, sort of experts, creating a public-private partnership called ACTIVE, Accelerating COVID-19 Technological Innovations and Vaccines, to sort of advise pharmaceutical companies about how to best devise and test both antivirals and vaccines. And then I was on the FDA's Vaccine Advisory Committee. But that first year was rough. And I think that in some ways it was very emotional for me. And in part, that's why I wrote this. I mean, I don't know if you remember the way this played out, but in April, when our ACTIVE group got together, the FDA, under tremendous pressure from the White House, approved hydroxychloroquine, an anti-malarial drug that the government believed was the magic medicine to get us out of this pandemic, based on something that America's Frontline Doctors, which was a group affiliated with the Freedom Caucus, had sort of put forward as that magic medicine. And the FDA approved it without any evidence that it worked, without any evidence that it was safe or that it was effective. And so the studies were done. After study after study after study showed that it didn't work to treat the disease, it didn't work to prevent the disease, and it had a side effect, I guess, that we all knew about, which is cardiac arrhythmias, which could be fatal. And so then 3 months later, after approving it, they took it off. They didn't authorize it. So that scared people. And what happened was a number of states formed their own vaccine advisory committees. They didn't trust the CDC or the FDA to do the right thing. They felt that they would be politically influenced. And then what happened, I actually wrote an op-ed in the New York Times with Zeke Emanuel from Penn, fearing an October surprise, because it was clear that President Trump wanted to have this fixed vaccine out before the election, which was the beginning of November of 2020. Well, as it stood, the way these trials were going to play out, you always have to do safety follow-up 2 months after the last dose, which took you into December. And I've heard this from someone inside the FDA, what Donald Trump did was he pulled Stephen Hahn, who was the commissioner of the FDA, into the White House in an invective-laden tirade, asked him or told him to approve this vaccine or authorize this vaccine before the election. And Hahn stood tall. He said no. On the next day on his website, he said this is a 2-month follow-up, safety follow-up. And so the vaccine wasn't going to be available till December. And but you saw the fear that was created by the fact that that politics would trump science, that the administration could essentially neuter what were the sort of safety guidelines that were all in place for the way we make every vaccine. And so there was that going on that year, and that was a rough year. And then there was sort of this amazing series of contrasts, which is really at the heart of why I wrote the book. On the one hand, in 11 months, with a difficult virus in terms of its unusual clinical or biological characteristics, we made a vaccine using a technology that had never been used before, ever. We had no experience with it, messenger RNA. And it was a 40,000 person trial for Pfizer, a 30,000 person trial for Moderna, and the vaccine worked and was safe. It wasn't absolutely safe, but it was safe. And then we did something else that was amazing, which is that we mass produced, not easy, by the way, for a lipid nanoparticle vaccine to mass produce it. We mass produced, mass distributed, mass administered a vaccine in a country that didn't really have a system in place to mass vaccinate adults. And so we vaccinated 1 million people a day, 2 million people a day, 3 million people a day. And then around the middle of the year, January 2021, we hit a wall. 30% of this country refused to be vaccinated. They just didn't buy it. They didn't trust the FDA. They didn't trust the CDC. They didn't trust the government. They didn't believe that the disease was that bad because they didn't trust the statistics they were seeing, and they refused to be vaccinated. And as a consequence, 300,000 people in this country died because they made that choice. So on the one hand, you have this technologically advanced, wealthy country that had an amazing technological achievement that was rejected by a significant portion of the country, causing them to lose their lives. And that whole phenomenon and why it happened and how could we avoid it next time was why I wrote the book. That's a long answer to your question.
It's okay. It's okay. Who's the audience for the book, Paul?
I think the general public, anybody who experienced what we all experienced. I mean, it was a rough 4 years for me, for all of us. And I think this is kind of a summing up in many ways and how to move forward.
When did you start writing? I'm curious how long ago that was.
Right from the beginning. I started working on it right towards the beginning of this pandemic because that worked well. I mean, I was able to include a number of stories as they were happening. So that worked well. I didn't know when this pandemic would ever end. And I guess we have different definitions of pandemic. And on TWIV, you've gone through very carefully what those different definitions are. But I guess my definition is that a pandemic changes the way you live, work, or play. And I think that's no longer true. So I think the pandemic is over, but the virus isn't over. And so how to handle it now.
So when did you finish writing? Let's put it that way.
Probably about a year ago.
Okay. So you dedicated the book to Charlotte Moser. I'm curious as who she is and why you did that.
Yeah, so I've been working with Charlotte for more than 25 years. She came to my lab as a technician, as a young woman, right around the time she got married. Now she has 2 adult children. And she's just a brilliant, hardworking virologist who worked in the lab. And also when we created our Vaccine Education Center in 2000, she became part of that and now is very much the heart of our Vaccine Education Center and putting out information to try and educate the public and the press and physicians as well about vaccines and vaccine safety. So she's been a touchstone for a few decades, and that's why her.
I think I recall you authored a book with her about questions that parents might have about vaccines, right?
Right, and we're updating that book now. It's Columbia University Press, will be coming out soon. Yes, that's right.
So in the summary of the book, you talk about writing about things we got right and things we got wrong, and you just talked a little bit about things we got wrong. What did we get right?
Well, we got the vaccine right. I think we definitely got that right, which is remarkable considering how little we knew about this technology. So we certainly got the mRNA vaccines right. That was I think the most important thing we got right. And I think the other things that we got right are, I think there were a number of bright lights here. I think the expanded access program to collect convalescent sera was the right way to go early on when we didn't have anything. You could argue that we could have done better about how we used it and implemented it, but putting that program in place early on was, I think, something that was right. I think people like Ayla Stanford, who is an African-American surgeon who works at Temple, who when this disease hit, formed something called the Black Doctors COVID Consortium, and she went out there before there was a vaccine to test people in North Philadelphia, primarily a Black and brown community, to make sure that they knew who was sick and could isolate and quarantine. And then when the vaccine came out, she went and sat in people's living rooms and explained why they needed to get a vaccine. And if they said no, then she came back. And if they said no, she came back again and ultimately vaccinated 50,000 people in North Philadelphia. I mean, we should have had 1,000 Ayla Stanfords. And then I think we may not have had that 30% of people who refused vaccine. So that was another thing we clearly got right.
Sometimes just sitting down and talking with people in person is what's needed.
Yeah, and someone who looks like you, who has shared
Yes.
attitudes and beliefs and backgrounds. And I think that's why they could trust Dr. Stanford. And I think that You see that in other settings. I mean, when the anti-vaccine people sort of entered the Somali American community in Hennepin County, Minnesota, and there was a drop in immunization rates, and there was an outbreak of measles, the Minnesota Health Department sort of talked to the imams, I mean, the religious leaders in that community who had influence, to try and influence that community, and gradually have gotten vaccine rates up. So that's it, finding out who is it that is influential locally, and to provide them with the tools that they need to do the influencing. Because I don't think it's going to really happen at the federal level or at the state level. It's too distant. I think it has to happen locally.
So you point out a lot of issues in the book where incorrect conceptions about epidemiology, virology, immunology ended up being presented and amplified. And I wonder, you think it might have been useful to have more scientists, basic scientists involved in the public health messaging to try and get it better?
Yes, I do. I mean, you know this better than me. I think the training that you have in basic science in many ways is the opposite of the training for what you need to do to be a good public health messenger, I think, because as a scientist, you're praised for never going beyond your data. So a discussion section is full of caveats. You know, this is what I can say, but this is what I can't say, over and over and over. And so that sometimes is viewed in the public health forum as being weak or indecisive or unsure. So I think you have to be clear about the messaging, knowing that you're learning as you go, which I think was the hardest part in all of this. It was a new virus. It was a disease we hadn't seen before. It was a new vaccine technology. You knew that there was going to be a learning curve here, because that's always true. And that learning curve is often associated with a human price, which was true, for example, with the Johnson & Johnson vectored virus vaccine. I mean, this was a vaccine that came out in February of 2021. And we found out fairly quickly with the surveillance systems that were in place that it could cause clotting, including clotting of the brain, including fatal clotting of the brain. It was rare, maybe 1 in 200,000 people, so you're not going to find it out pre-authorization, but it was real. And when that was clear, and it was clear that the mRNA vaccines didn't have that severe of a side effect, it was taken off the market in May of last year. And so some people will look at that and they'll say, see, they don't know what they're doing. But it's the fluidity of the science is disconcerting.
The FDA commissioner standing up to the president was the right thing to do, and say, yeah, we have to complete this. Otherwise, people would trust the vaccines even less.
That's right. And nobody really saw that. I don't think anybody saw what was going on. We did in the FDA Vaccine Advisory Committee, because we saw other states sort of forming their own vaccine advisory committees. Imagine how that would play out. That some states said, yeah, I think we should use this vaccine. Other states said no. It was a wild time that first year, because, thousands of people were dying every day. We didn't have antivirals. We didn't have monoclonals. We didn't have vaccines. And all we had was isolating and quarantining and restricting travel and closing businesses and closing schools, just trying to limit human contact. And it was a terrible time. And we shut the economy down, and we were desperate for something. And then we had it. The most amazing thing is we had it. Those mRNA vaccines were our ticket out of this pandemic, a ticket that a surprisingly large number of people chose not to take.
Yeah. Well, you also talk about some other topics like, should the vaccines have been mandated? Should schools have been closed for so long? I don't want to talk about those now. Let's get you on TWIV for a deep dive, because those are topics that we can talk about at length, I think. But I want to have you end with a statement that you make in the introduction. You say, I worry that this learning curve, which was the learning curve of knowing how to deal with the pandemic during it, has come at the expense of the public's trust in the people and institutions that were responsible for these decisions. What do you mean by that?
Right. So the question is how best to have communicated all of this. I mean, when you learned, for example, that the Johnson & Johnson vectored virus vaccine wasn't what you hoped in terms of safety, how best to communicate that with the bivalent vaccine, for example, which wasn't a bad idea. I mean, Omicron had come into this country. It was immune evasive. Why should we still just use the Wuhan 1 or ancestral strain? Let's also use this strain, whether it was the original BA1 Omicron or BA4, BA5, which is what we did use, to use 2 half doses, ended up not being such a good idea. Because it wasn't better than the monoclonal vaccine, as the monovalent vaccine. So how do you explain that to the public that this bivalent vaccine, which we had touted as being better, wasn't better? It wasn't worse. Boosters boosted. It still was a value for people who are in high risk categories. But how do you explain that to the public without losing trust? How do you say, look, we didn't get this exactly right? Because you're never going to get it exactly right the first time, often. How do you explain that without losing the public's trust? And that was, I think, the challenge here.
So where do we stand in terms of the public trust? We need to vaccinate people for everyday diseases that we know exist. We have to make sure people take antibiotics and antivirals and so forth. Has that impacted those areas, you think?
Yes, I do. I think we underutilize antivirals. I think there's a significant percentage of people who are hospitalized or die from them who are in high-risk groups who, had they tested themselves early and treated themselves early, could have avoided that hospitalization or death. So I don't think we've been great about this. I think, look at what just happened today or in the last 24 hours. The CDC has changed their recommendation apparently about how to isolate and test regarding COVID. And are we getting that message out there in a way that's clear? Or more importantly, are we getting it out there in a way that explains why we're making this change? And I think that requires constant talking, really, not just by the CDC, but by local, state and local health people to explain this. Here's the science on which this is based. We don't know everything, but we think we know enough to make this, and here's why we're making this change, and to just be out there and constantly talking. And it's funny, Richard Besser was the head of the CDC in 2009 during the swine flu pandemic, and he was great. I mean, he was out there every other day talking to the media, or said another way, talking to the public, answering their questions about the vaccine, answering their questions about the disease. I saw him at a recent National Foundation of Infectious Diseases meeting and went up to him and I said, "You were great during that time. Thank you. That was a model for how to communicate science to the public." He said, "Thank you. I could never do it today." 2 reasons: politics and social media.
I also think the CDC for years had felt they didn't have to explain anything. They just said it, and then that didn't work in the pandemic. So they have to change, and then a big organization like that simply doesn't change quickly.
Right. Or in the case, for example, of this recent false or unnecessary concern about whether DNA fragments in an mRNA vaccine are in any sense harmful. Get out there with the science. Just get out there, about here's why it doesn't make sense that this is true. But what you tend to get are statements of, this is thoroughly tested, we care about safety, which are basically other ways of saying trust us. And I think trust the public to try and understand science. You can explain it as you do on Twitter, at roughly an 8th grade level, which is to say newspaper level, at a level that people can understand. Trust them to do that.
Do you think the current measles outbreaks in Europe and the U.S. are in part due to this lack of trust caused by the COVID situation?
Yes. I think what happened is, with the mandates, we leaned into a libertarian left hook. This was, especially because people lost their jobs. They couldn't go to the bar they wanted to go to. They couldn't go to the restaurant. They couldn't go to a sporting event or religious ceremony. And so, and when you do that, you have to also explain, why. Because what we didn't do was say what the vaccine will do. It will prevent you from having severe disease, but it may well not prevent you from having mild disease for very long. And so when people saw that you were mandating a vaccine that in their mind didn't work, right? I got the vaccine, they made me get it, and now still I have a mild infection, I'm still contagious, and so they lied to me, and because we didn't really explain what the limits of what this vaccine could and couldn't do. I think the CDC has learned that lesson at some level, because with the flu vaccine in this current campaign, they're calling it wild to mild, meaning take severe symptoms and move them to the mild symptom category. Right, that's a better example of how to explain this. But I do think when we leaned into this libertarian left hook, you now see, as was explained in a recent CDC publication in November of last year, in Morbidity and Mortality Weekly Report, that there is an erosion in vaccine rates among kindergartens. There's more who are choosing philosophical or religious exemptions, and that is a warning sign, because measles is going to be the first disease to come back when you erode immunization rates, and that's what you're seeing. We had an outbreak here in Philadelphia not long ago.
Well, let's continue this conversation on Twiv with some of the other hosts. It should be a lot of fun. Meanwhile, you can read this week's column over at Substack. We'll put a link to that in the show notes, and go out and buy Tell Me When It's Over. You can get it any place where fine books are sold. That's Beyond the Noise with Dr. Paul Offit. Thank you, Paul.
Thank you, Vincent.